are going to be presenting today on the shoulder bursa, and my name is Preston.
I'm Catherine.
And I'm Joe.
All right, so we're going to get a little bit into what is an actual bursa. And so a bursa is a sac-like membrane. They're called synovium, and it's going to be filled with synovial fluid as they are normally in a lot of the synovial joints. And its wall structure is similar to that of like a joint capsule. And they're typically going to be located in the tissues such as between bones, muscles, and tendons and the skin. And a fun little fact is they're actually capable of regeneration. So the function and the structure of the bursa, the function is mainly to decrease the rubbing, friction, and irritation that can ongo in the rotator cuff muscles especially. With different movements and constant repetition, it can create a lot of friction, so it's very good and important to not have a lot of rubbing going on there. They have varying sizes, so usually between 0 and 7 millimeters, but the typical size is about 2 millimeters, and they're pretty flat for the most part. And it's pretty pliable texture and structure, so almost like this water balloon that we have here. They're pretty flat, they're going to be able to move around, and there's a lot of give and take within the shoulder that allows them to be so effective.
So now we're going to talk about the specific bursa in the shoulder joint. The first being the subcoracoid bursa, which is shown in picture 3 here. And just to get rid of any confusion, don't worry about the other structures or numbers here. We're just going to focus on number 3. And this bursa reduces friction between the coracobrachialis, the short head of the biceps brachii, and the subscapularis. And Preston's going to show with our water balloon over there on the model as well.
So as you can see here, it's going to be located inferiorly to the subcoracoid process there. And like she said, it's going to reduce the friction between the coracobrachialis and the biceps brachii and different structures within the shoulder area.
The next bursa is the subacromial bursa, and this allows frictionless gliding between the humeral head, the supraspinatus, and the infraspinatus tendon, so in that rotator cuff area. The lateral portion of this bursa creates a smooth surface for the acromion and the deltoid to glide over the head of the humerus and rotator cuff tendons, while the medial portion cushions the coracoacromial ligament. And this is shown here at the top of the diagram there.
All right, so coming back into the skeleton over here, it's going to be located right below the acromion, and it's going to be more medial than the head of the humerus right there, but it's going to sit right about there and provide a lot of assistance in that region.
Next, we have the subdeltoid bursa, and this allows frictionless gliding between the humeral head and the supraspinatus and the infraspinatus tendons again. And you can see it kind of right here in this diagram. It's more lateral than the previous bursas that we've been discussing.
Alrighty, so coming back to the model, it's going to be more lateral, as she said. So we had just looked at the subacromial, which is going to be kind of right about here, but this one's going to be more on the head of the humerus, and it is going to be helping in those joints.
The fourth and final bursa of the shoulder joint is the subtendinous bursa of the subscapularis, which you can see right here. It's more on the anterior side of the scapula, and this reduces friction between the subscapularis and the humerus.
All right, and this one is going to be right about here. It's going to be pretty close to the same area as the subcoracoid one was, but it is going to be located right about there.
All right, so the final thing we're going to talk about today would be bursitis. So this is one of the common injuries that you would see involving the bursa. So basically it's just inflammation or irritation of the bursa. It often involves the rotator cuff, and it generally happens through a gradual onset. So if you look at the picture to the right, you'll see a normal bursa right here, and then an inflamed bursa over here, a bursitis. So when that becomes inflamed, it enlarges, and then it can cause all sorts of impingement on nerves and a lot of friction in between the muscles, which starts to cause pain and a lot of other problems. The common mechanisms for bursitis are essentially overexertion and repetitive motions. So you may see it in a baseball pitcher, someone who does the same motion over and over again. They can also happen through more serious sudden injuries like a blow to the shoulder, but generally you will see it through overexertion and repetitive motions. So just to recap what we talked about today, we talked about the four bursa of the shoulder, so the subcoracoid, the subacromial, the subdeltoid, and the subtendinous bursa, the subscapularis. And then we also talked about bursitis. So thank you for watching, everybody.